Overall, 7,330 individuals have been tested for COVID-19. Currently, we have 1,350 tests that are pending. I will now share the most current case counts. There are 53,236 confirmed cases of COVID-19 in Canada, and 16,187 cases are in Ontario. Chatham-Kent has 83 cases, and Sarnia-Lambton has reported 183 cases. Michigan now has 41,379 cases, with 9,057 cases being in Detroit. Today, we are reporting 604 cases of COVID-19 in our community, an increase of 10 cases from yesterday. 42% of our cases have occurred in long-term care homes, including both residents and staff. 191 cases have resolved. 19 people are in hospital. 15% of our cases are between the ages of 20 and 29 years. 16% of our cases are between the ages of 50 and 59, and 22% of our cases are 80 years and older. 40% are male, 59% are female, and 1% remains unknown. We are reporting no new deaths today. Our community has lost a total of 50 people to COVID. 36 people have died in long-term care or retirement homes. Our health unit is working with 7 long-term care and retirement homes that are currently experiencing COVID outbreaks. As we go into the weekend, I'd like to express my thanks to our EMS partners, hospital partners, Windsor Regional Hospital, Hotel Dieu Grace Healthcare, and Erie Shores Healthcare, and our 2 nurse practitioners who have been working so hard to complete testing in our long-term care and retirement homes. All of their help is truly appreciated. Testing for COVID-19 is based on a clinical assessment. Symptoms of COVID-19 include fever, cough, difficulty breathing. However, other symptoms may be present, such as being extremely tired, falling, nausea, vomiting, chills, headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online self-assessment tool at ontario.ca, contact Telehealth Ontario, call your primary care provider for a phone or virtual assessment. They will be able to guide you in next steps, including contacting public health or attending an assessment center. To access the virtual walk-in clinic, please visit eHealth.windsor-essex.ca. Windsor-Essex has 2 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. Please continue to visit WECHU.org for the most current information and case counts. And I'd like to remind you that we will resume Facebook Live after the weekend on Monday. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, and thank you for joining us again. I wanted to take a minute before I start our data presentation to express my thanks and gratitude to the residents of Windsor and Essex who take time out of their day to join Teresa and myself every day on Facebook Live. It has been our commitment throughout this pandemic to provide our community with transparent, timely, and credible information every day. We thank you for your kind words, your thoughts, and your commitment in helping to spread and share our public health message. We are truly in this together, and we could not make it through this alone. I also want to acknowledge the tireless efforts of our public health staff. Our entire organization has shifted to response while still maintaining critical public health services. Our nursing staff, dental assistants, hygienists, health promotion specialists, clerical staff, epidemiologists, managers, tobacco and vaping enforcement officers, registered dietitians, and health inspectors have all been deployed to COVID-19, responding to calls, contact tracing, enforcement of emergency orders, testing and assessments, delivering personal protective equipment, and responding to complaints. Our communication team has worked day and night to revamp our website, social media, and messaging to ensure that we provide our community with the information they need at the time they need it, and our maintenance and IT staff have kept us connected and safe, whether at home and in our offices. This has all been done in a matter of weeks while continuing to support urgent dental care for our seniors and children, supporting vulnerable pregnant women and new mothers, and maintaining essential inspections and responding to complaints. It is through their hard work and dedication to our community and public health that we are able to support this community during this critical time. So thank you all. I would now move on to our EPI summary for this week. So very quickly, once again, this is what we will cover in our presentation. I'll focus on the key points to answer some of the questions that everyone, including myself, ask every day. The conclusion we will draw on these data will help us to apply evidence-based decision-making in public health recommendations. So I want to start off with this data to look at the percentage of emergency department visits that were based on one's symptoms. And these are not official diagnoses. We use this type of surveillance system to identify any particular trend that is happening in the emergency department. And as we can see, the symptoms are an indicator of our respiratory season overall, and it's now comparing last year to this year. Our season typically starts in September 2019 and ends in August 2020. You will notice some similarities between the 2018 and 19 season in the beginning of the year, especially the peak, which is usually what we expect because of influenza every year. The green line is our current season, and the dark blue line is our 2018-19 season. The two red circles highlight an increase in which could be partially attributed to influenza and potentially to COVID. So that was the trend that we noticed starting back in early March, mid-March, that there was this spike, which is continuing to show, and comparing it from the previous year's average, we can see that clearly there has been more activity related to influenza-like illness, pneumonia, sepsis, or suspect COVID cases in our region. And then we use the EPI curve to help assess the progression of the disease, whether in the community or in an outbreak situation. This particular EPI curve is created to show the number of confirmed cases by symptom onset date. And on your vertical axis, you have the number of confirmed cases, and on the horizontal axis, we have the dates that these cases started showing symptoms. These cases include cases in the community as well as in the long-term care home and retirement home. Please note that the data presented in the shaded area may not be reported yet to public health and may not be entirely accurate and subject to change. When we are presenting the EPI curve with day-to-day variation and we are trying to get a better understanding of the trend, sometimes we combine the data to show a picture of what happens every 3 day or every 7 day. In this case, we chose to present data for 3 days to identify a trend. As we can see that it is very likely that we have reached our peak and are doing better. Please note again that the data presented on the right-hand side of the graph may not be reported yet to the public and may not be entirely accurate and subject to change. Another way to present our EPI curve is to present a 3-day moving average instead of 3-day aggregate data for the 3 days that I presented in the last slide. Similar trend we can see that we have likely hit our peak and are moving in the right direction. We created this particular graph to see how these cases are now shifting from community to long-term care homes. As we talked about, that most of these cases are now happening in the long-term care home, and this graph is showing that. It's showing the number of confirmed cases in the community, which is in the dark green shade, and the cases in the long-term care home, which is with the light green shade on the axis. The next logical question comes to our mind is, are we seeing this how are we comparing ourselves with the rest of the province and some of the surrounding regions, and how others are doing. We looked at the regional and provincial rates per 100,000 population, and we used these statistics to compare to the number of cases based on the population size, because obviously when you're talking about a larger community, the cases will be higher. Smaller community, the case count could be low. But when we standardize this data based on 100,000 population, we can compare some of these data across different regions. What we can see is this still does not account for the variation between the ages and demographic of the population. So any community like ours, where we have a higher number of seniors, which is roughly 18%, 65 years and older, we may see more cases in the community, and its comparison with the provincial average, which is the 16% seniors overall in the province of Ontario. The next question that comes to my mind is, how about the testing? How many people are being tested every day? And among those who are tested, how many of them are coming back positive? This is an indicator to show how prevalent the disease is in our community. If more people are getting tested and a lot of them are not coming back positive, that means we are getting into the situation where less and less people are contracting COVID. Initially, when we started, the positivity was close to around 20%, and it's now dropping down closer to 5%, and with some caveat that the data on the right-hand side may not be entirely accurate because of the delay in reporting data. Another question that is frequently asked is about asymptomatic people coming back positive for COVID-19. We did some proactive testing in 3 long-term care homes and retirement facility, and tested 407 residents and 158 staff in these facilities. This is a preliminary analysis of person positivity among symptomatic and asymptomatic individuals, specifically in this group. As you can see, there's a significant variation between symptomatic staff and symptomatic residents, and asymptomatic staff and asymptomatic resident when it comes back to person positivity. Based on the preliminary data, we can say that roughly 4% of the residents, again, this is just about the population that we looked at, 4% of the residents within a long-term care homes without any symptom can still be positive for COVID-19. As you're aware that Public Health is working closely with EMS to test all the long-term care home and retirement homes, the hospitals, including Windsor Regional Hospital, Erie Shores Healthcare, and Hotel Dieu Grace Healthcare, are also providing staffing support to complete the mass swabbing in a short period of time. Most of these homes are prioritized for swabbing based on their risk assessment as assessed by the public health units. From a public health action perspective, this means that we still need to focus more on the infection prevention and control measure while we are caring for anyone who is COVID positive or who is not COVID positive. Following all the right infection prevention and control measures will still stop the spread of the disease among the residents. So it is very important for everyone who's working in these facilities to follow the good infection prevention and control measures. Next is the age and sex distribution, and the purpose of creating this graph is to show if there's any difference in the ages or how bad or good one particular age group is performing. The shift in numbers, what we can see is it's getting pretty evenly distributed with the early younger people between the ages of 20 and 29, and most of those individuals are healthcare workers. That's why we are seeing an increase in that population, and no surprise there, as we are looking to the bulk of the cases. It's between the ages of 40 and 60, and highest in the elderly population, all because of the long-term care homes that were infected with COVID-19. So next is the distribution of cases by municipality. No surprises there. More than 2/3 of the cases are in Windsor, and the rest is distributed pretty evenly across the other municipalities, with the exception of one municipality, and that is attributed to the large number of cases in the long-term care home. But once again, the reminder is it doesn't mean that one municipality is doing better than the other. The COVID exists everywhere. and everyone need to take precaution irrespective of where they live, and keep themselves safe and protected. So in early part of the, we created this graph to show the exposure history by reported date. And early part of the pandemic in Windsor and Essex, most of the cases were attributed to travel. More recently, we are seeing a significant shift in transmission between a close contact, and in the middle, we see community transmission, and now we are seeing a decrease in community transmission. Please note that the travel in the recent cases are attributed to healthcare workers that are currently working in Michigan. This also shows the impact of our measures. If we can track down most of the cases to a close contact, that means we are reducing the community spread. This is what we want before we start talking about opening up or easing some of those restrictions. If you look at the cases in the last few weeks, most of the new cases are happening in close contacts, and that can be attributed to the strong case and contact management and ensuring that all the cases and contacts are following all those precautions that they should. So looking further into the COVID-19 by healthcare worker status, and as we can still see, approximately 30% of the cases in our community are occurring in healthcare worker. And of the 117 healthcare workers, 178 healthcare workers, 49 have recovered. And around 6% of these cases visited a healthcare facility before getting infected. This highlights the importance of, once again, following the appropriate infection prevention and control measures while the healthcare workers are working in these facilities. The next is the risk factors for identified at the time of the interview with all the cases in our community, and do they have any chronic illness? We looked at our data to answer this question, and this is what we found. Roughly around 20% of our cases had some kind of chronic medical condition. A small proportion of individuals are also immunocompromised, and a significant number of people did not have any risk factors. So the message is, it can affect everyone, and everyone is at risk, whether young or old, healthy or not. And please follow the public health recommendations to ensure that you're not contracting COVID-19. Medical risk factors, as identified for looking further into the risk factors of what those chronic conditions look like. This is not a surprise that we can see cardiovascular disease tops the medical risk factors for in individuals who are COVID-19 positive. And my message to all Windsor and Essex residents, as we are focused now on COVID-19, we also need to watch out for all of our health behaviors and pay attention to our health. Obesity, cardiovascular diseases, smoking are a big concern in our community, and we need to work on it to make sure that we become more healthier as a community. A quick look at the cases and what symptoms they are reporting. Roughly 3/4 of the cases are presenting with cough, and the rest of the symptoms are identified at the chart right in front of you, including malaise, fatigue, fever, headache, chills, shortness of breath, nasal congestion, loss of appetite, diarrhea, and muscular pain. Please note that the cases can report more than one symptom, and that is why these numbers will not add up. The next slide shows what happened with all the hospitalizations and the ICU beds that are being in the hospital. And this figure shows the number of hospitalization and patients in the ICU in a given day. It includes both new patients and existing patients with COVID-19. And as we can see, we are seeing a decrease in the number of cases ending up in the ICU in the past week. Our hospitalization have not peaked as predicted, but it's rather stabilized, and we are looking forward to see the impact of what is happening in the community, reflecting back in the hospital system as well. So the next is, how are we doing with the outcome of these cases? And roughly 35% of these cases are self-isolating. Same as last week, no changes there. More than 31% of the cases are resolved or recovered, same as last week. And unfortunately, we lost almost 9% of our cases to COVID-19. Less than 4% of the cases are currently in the hospital or ICU. Some of these cases that are self-isolating may not have been admitted to the hospital, but initially, some of the cases are self-isolating now may have been admitted to the hospital initially, but discharged when they didn't need inpatient care. Please note that this does not include individuals who are at the field hospital. We're still investigating a little under a quarter of the cases that we still don't know how they're doing right now. Looking at the age and sex breakdown of COVID-19 deaths in our community, and we can see all except a limited number of deaths. Majority of these deaths are happening in individuals over the age of 60 and above. This particular graph shows that what it means for an individual who contracts COVID-19 in our community. The overall case fatality rate is 8.4%. Those who are living in the long-term care home and retirement home, our case fatality rate is significantly high, almost 15% in that age group. And that is why all the attention and focus is now shifting to that group to make sure that they are getting all the support that they need. As of April 29th, the case fatality rate overall in Ontario was 6.7%, and our overall is 8.4%, which is slightly higher than the provincial average. Now, looking at the case doubling time, this is the aggregate number of cases that we have seen right from the beginning to now. And last time when I showed this graph, we were in the upward trajectory with respect to the cases. But as we are seeing that we are flattening more and more, and we have passed the 4 days mark, and we're inching towards the 5 days mark as a case doubling rate. So I'll stop here, and I'll happy to take some questions.
We'll now take questions from the media. We'll start with CBC.
Good morning. I just wanted to go back to the asymptomatic testing. That was in long-term care. It was about 6%. Can that be transferred to what we would expect the community asymptomatic rate would be?
I cannot say that it could be similar to community, because what we know in these long-term care homes, many of these individuals, they are very sick and they may not show symptoms as compared to the rest of the population. So that is why the data can only be limited to the long-term care home facilities, and I don't think that it can be translated exactly in the community.
We had some people contact us yesterday hearing about the migrant workers. Is there a possibility that COVID could be transferred on food?
There is no evidence from the research that COVID-19 can be transmitted by consuming any food product or anything. Our recommendations in terms of ensuring when you're bringing food back to your home, all the perishable items, just wash it with cold water thoroughly. Do not use any chemical on any of the food product. There's been a number of cases in the U.S. with people when they're trying to use any type of chemicals or disinfectant to clean the food product. There is no evidence that COVID-19 is transmitted this way. It's a respiratory illness, and it's mostly transmitted through the respiratory droplets.
And today the mall opens. Do you have any concerns about that reopening?
Well, any businesses that are currently operating, they have to comply with the provincial regulations, what's allowed and what is not allowed. And as long as they are following that, they are meeting the requirements as it is. But we will be looking out to make sure that the compliance is happening, and any complaints that we will receive, we will take action as per our usual process, working with the law enforcement agencies and our health inspectors, depending on the type of establishment and type of offenses or complaints that we receive.
Thank you.
Any questions from Blackburn?
Yeah, going back to the chart with the outcomes, like looking at hospitalizations, it says 3% hospitalized. Is that over their entire course of their, COVID time, or is that just like currently how many people are hospitalized?
That is currently how many people are hospitalized, because the people may start from the hospital and then they're going back in home and self-isolating if they do not need any hospitalization. So it just tells you how they are doing right now.
And do you have any idea of how many people overall, like of the 604 confirmed cases, how many have needed some kind of hospitalized care?
I don't have that number in front of me, but I would say roughly 10 to 12% of these individuals needed hospital care. Majority of them are recovering fine in the comfort of their homes.
Any questions from CTV?
Curiosity.
Well, that I'll have to pass it on to my health inspectors, but those are the recommendations in terms of food preparations, and I think it's their recommendations.
Just curiosity. Death rate today was 0. Nice to see the 0. I assume that you're hoping for another 0 tomorrow.
Well, that is the hope, and all these efforts are being done to ensure that we are not losing any more lives, but we recognize that there are still a number of homes that are in COVID-19 outbreak. People in these facilities are really old and sick, and if they contract COVID, the likelihood of them dying is pretty high. So as a community, we need to be prepared, but also trying our best to prevent as many deaths as possible.
With the weather getting nicer, I assume that, even though the death rate is 0 today, and a lot of it is to the LTCs, you're still preaching not to let your guard down.
Absolutely, and I think as much as we are getting more comfortable in terms of what is happening with the number of cases in the community, I think it is now even more important to act in the most responsible way to keep it that way. And if we are able to limit the spread of the disease outside in the community, that will be a very good sign for the community. And then obviously we'll still have to maintain all those physical distancing measures and all the public health recommendations, but that's the place that we would like to be, where we are not seeing any community transmission happening in our region.
There's a lot of talk about the second wave. When this is going to happen, we don't know. Obviously that concerns you.
Definitely. I think unless we get to the stage where we are talking about the different public goals that we try to achieve, when we are talking about the ideal goal, we talk about complete elimination of the disease, eradication of the disease, where the disease do not exist in the world. There are very few diseases that has achieved that goal. When we're talking about diseases like measles, it's eliminated in Canada. So basically there is no case of Canada that is happening here. It has to be brought in from outside. So every case of measles that we are seeing, typically it is as a travel related. So that's the other goal that we'd like to achieve if we cannot completely eradicate it. And then if we can't do that, we take to a lesser goal, which is a control, which means basically we are trying to limit the spread of the disease in the community, because practically the tools that we have with respect to treatment or prevention of vaccine, we are not there yet. So until we get to this stage, we cannot achieve elimination or we cannot achieve eradication. So we only have to control as much as possible, and all these public health measures are put in place to ensure that we are controlling it in the best possible way and inching towards the elimination phase.
Any questions from AIM 800?
Yeah, you mentioned that we have an overall fatality rate of 8%, which is higher than the provincial average of 6%. Is that because we have a higher senior population here?
That is what our understanding is, because what we are seeing, even if you're looking at the number of deaths, most of these deaths are happening in the long-term care homes. So absolutely, it's all, we can attribute it to the higher number of senior population in our region.
You also mentioned that most positive cases now are due to close contact, whereas in the beginning it was due to travel history. How do you reduce the positive cases with close contact? Is that people living together? Is that people working closely together? And how do you reduce that?
So some of the close contact when we are talking about is even when we are seeing this spread in the long-term care home, that is also qualifies as a close contact. So anyone who is providing care to that individual, and if they get sick, a healthcare worker, if they're caring for that individual, if they get sick, then those are all classified under close contact, and same is in the community. So anyone who is living with another family member who is identified, and at the time of early onset of symptoms, they are exposed to that person and then contract the disease, those are the close contacts. So still, it means it's very a close-knit group. And if we can reinforce some of those measures that we want people to be mindful of, such as for the healthcare workers, monitoring their symptoms, ensuring that they are using all the appropriate infection prevention and control measures when they're caring for their patients, and also for all the individuals who are in the home, and if someone is sick, how they can maintain that physical distancing while still providing care to them, and reduce the close contact transmission happening in there. And as we can see, it's going down. It's pretty significantly down, but it would be very difficult in these type of close contact situation to completely eliminate this. But that's the goal with all the education and all the recommendations. If people are following that, we will continue to see a steady decline in that group too.
Thank you.
Any questions from Windsor-Essex?
Between yesterday and today, there were almost 900 new tests conducted, and the average for the last number of days has been between 100 and 400 or so. Was there just a big step up in number of tests conducted yesterday, or is that special testing done at long-term care?
Absolutely. All these numbers that we can attribute, at least in our region, is due to the testing in long-term care homes. And that is what we are hoping that the lab system will ramp up, and we'll get a good turnaround time. And those conversations are happening with the lab, and we want to get all those results back in a timely manner.
Any questions from the Windsor Star?
Yeah, Dr. Ahmed, regarding the slide on exposure history, am I interpreting it correctly to say that there's been a significant decline in community transmission cases?
That is the correct interpretation, that there's been a significant decline in the community cases, and that is our goal. As I said, it shows basically if the impact of our measures. So anything that's happening, if the community transmission is not happening, that means most people, when they're outside, they are following all these recommendations of public health. They're maintaining physical distancing. They're cleaning appropriately all the high-touch surfaces, et cetera, et cetera. So that's a good sign. But still, there's still a lot of work that we need to do in the community to prevent the transmission within close contacts and basically bring the case to almost to zero.
Looking at the slide, I see a peak around the first week of April 7th. Was that a result of more testing done at that stage, or was it an actual picture of how things were being spread in the community?
That was the result of a mass testing that happened and some testing delays, results delayed at the long-term care home, and the significant spike was seen in the long-term care home population around that time.
So, going by the figures, how heartened are you that people are doing the correct things?
Can you please repeat your question again?
How heartened are you? How do you feel about the fact that we have this picture of the community doing the right things?
Absolutely. I think that's why we said that I'm thankful to the community for following all those recommendations, and without their support, we wouldn't be here. So I think it is definitely a good sign, but it's not the time to lose our guards. We still need to do what we are doing to make sure that we can bring it down to a level which does not affect our community, it does not affect our life, and we can try and get back to the post-COVID normal era as whatever it would look like in the future.
Thank you.
Any questions from Radio Canada?
Yes, please. Thank you. So what elements may indicate that we are starting to see enough improvement to consider a local deconfinement, given the fact that the situation here is very different from the one of Toronto, for example?
Sorry, can you repeat your question again?
Yes. What elements may indicate that we are starting to see enough improvement to consider a local deconfinement?
Yeah, so thank you for the question. So yeah, that's a good question, that in terms of what we can see in the community. And as Premier Ford laid out the plan or a framework to open up the easing off restrictions and reopening the economy, one of the things that I would be interested in seeing is, again, seeing a significant decrease in the community transmission. We just talked about that. Also, we would like to see some consistency. We like to see that the cases are being stabilized. We also like to see that many of these cases are now in the long-term care home and the retirement home. Do they have enough PPE? And is there any steady supply of PPE coming in? What about their staffing issues? Have we figured out a way to address that issue? And what about their infection prevention and control measures, and if everything is followed as it should be? And as a community, what have we learned? And are we following those measures as physical distancing, taking appropriate precautions when we are outside? And we'll try to make an assessment based on that to feel if the community is ready to go back to the easing off some of those restrictions. These numbers are there, which is definitely a help. But some of these measures are difficult to quantify, and we're trying to get a sense of how can we quantify that and present it in a more meaningful way to make those recommendations that, yes, it seems like this is about time that we can go back to easing some of those restrictions that are currently in place.
So you think that if those conditions are there, thinking about a local deconfinement could be, we could think about a local deconfinement.
Absolutely, and I think one other thing that we are definitely very different from Toronto in so many ways. We are a border city, and everything that we are doing, it also have an impact on what is at the border situation. How many travelers are crossing the border every day, and how could it impact our community? I haven't seen any of those details that when those travel restrictions are eased, and when people will be allowed to travel more. So again, those are all the local issues that we have to consider before we feel confident in our measures that, yep, we are prepared as a community to ease off some of those restrictions. Some of those decisions will be made by the province, but we will see what decisions needed at the local level, and we'll be working with all our community, municipalities, all our leaders in the community to make those recommendations.
Thank you. And I have a second question. I've heard that some of the Devonshire Mall will open some shops, and I've heard yesterday about the opening of a shop where people buy plants. What do you think about that?
So I think we'll have to look at the provincial regulations, and maybe we can try and see if they're meeting those regulations or not. If they're not meeting the regulations, we will be contacting them, again, depending on the scope of what kind of facility it is, whether it's the law enforcement agencies or whether the public health inspectors. But we will follow up on that if that's a complaint from the community.
Thank you.
Any further questions from CBC?
Yes, I know on Monday I had asked about the unknown cases, and the outcomes right now are at 21% unknown. Should we understand that to be people that aren't responding to calls from nurses? Is that why they're unknown still?
So there are a lot of reasons for that. A lot of that is that we, like, especially from the data that we are receiving from the lab, sometimes it's delayed, and sometimes there's a delay in connecting with them. There are individuals who are in long-term care homes. They are not identified as such. So there are a number of issues from that perspective that we are seeing. But most of the individuals that we are getting from the community, from the assessment centers, we are able to contact them. I can't think that there are many individuals who never responded to our phone calls or anything like that. We are working down with almost every one of them.
So unknown can be people within a long-term care facility?
That is what my understanding is.
Okay, thank you. Any further questions from Blackburn?
Yeah, one of Premier Ford's conditions opening was that the public health units could contact all of the positive cases, or 90% of the positive cases, within one day. What will it take to get there? I mean, especially since there are 1,300 tests pending. That seems like one of the criteria that would be a far way out.
Yeah, no, we can say that we are making those contacts within the 24 hours with most of the cases that we are seeing, and some of the delay in the testings when we are happening. So there are a number of issues. Many people who are going to the assessment center are getting tested. We are not getting their report as we normally would do. There are some reporting delays, and by the time when we are getting that results back, the understanding is the assessment center and all their healthcare provider who tested them, they have provided them with all the information that they need for a self-isolation perspective. But getting in touch with from the public health, it could be delayed by the report that we received. But the moment that we receive our reports, we get in touch with them immediately, and then we try to provide all those education. So we are confident that as the number of case counts are getting low, we will be able to do all of that in a very short period of time, and some of those are just as a result of reporting delays.
But with the 1,300 pending tests, I mean, I know you said there's delays in the labs and there's conversations ongoing. Is there anything that we can do locally to get these tests back quicker, or is it just kind of out of our hands?
It's out of our hands because it's the labs and the lab's capacity. I know all the labs are working really hard to provide the results as quickly as possible. There are a number of issues that comes with the logistics of how these swabs or these specimens are being transported to the lab, and if the lab have the capacity, they have to test this specimen within the 72 hours timeline to make a good test. Otherwise, they have to freeze the specimen. So there are a number of technical issues that goes with it, and none of the labs were equipped or prepared to deal with this type of volume of testing. They are also limited by the number of machines that do this testing, and also the reagents that we need for all these testing. So there are a number of issues that they are trying to address, and we're hoping that as we are moving forward quickly, we should be able to get all those answers.